はい、OK。So today's topic is this: role of caregiving work and then professional ethics. Okay, there are two topics: professional ethics of caregivers and multidisciplinary cooperation. Okay, first, professional ethics of caregivers. There are four topics. One, respect for privacy. Second, confidentiality obligation. Third, prohibition of physical restraints. And prevention of abuse. Okay, so before proceeding, I want to ask you what is ethics means or professional ethics means. I know everybody heard ethics and professional ethics, right? Anybody can explain what is ethics or professional ethics means?
Sensei, it's like the set of values that you have to practice in the workplace.
Very good. Yes. That's correct. So you talk about the professional ethics, right? Professional ethics. Good. So ethics is a system of moral principles. Moral principle. Moral, まあ道徳ですよね。道徳的、なんていうんですかね、規律というか、がエシックス。で、professional ethics is personal or the corporate standard of behavior expected by professional. So, to put it simple, for the caregiver, what you must do or what you must not do. Okay, that is if I explain simply, for the caregiver, what you must do or must not do. Like for example, respect for privacy. Caregiver must respect for users' privacy. Or confidentiality obligation. Caregiver must maintain confidentiality of user. Okay? Or third one, caregiver must prohibit physical restraint, and caregiver must prevent abuse, or caregiver must not abuse. Okay, that is the ethics or professional ethics. Okay, let me discuss about this. Respect for privacy. Okay, caregiver support the user's everyday life. So we do bathing care or excretion care, right? Of course, nobody want to be cared in restroom, right? So caregiver, so you always put yourself in user's shoes, okay? User's shoes. So when you help the user, okay, when you do the toileting care, assistant with toileting, of course the user feel embarrassed, right? Embarrassed. Or when you help user take a bath, the user will be embarrassed. So that's why the consideration for privacy, like this, you put the towel on exposed skin. Or here, you put the towel over the knees to protect, not for user not to be embarrassed. Okay, in that assistant with toileting, after securing security, you just go out from the restroom, then wait outside because there is a call bell. Okay, when user finish excretion, just ask him to push the call button, then caregiver enter the toilet, CR. That is also one of the respect for privacy. Okay, like this. By the way, so you see the older people, right, on the toilet, then cover the there is a towel. Can I ask what is genital area in Japanese? What is genital area in Japanese?
陰部。
陰部。
陰部、good。そうです。陰部。陰部ね。ジェニタルエリア、陰部。そう、陰部とかね、ちゃんと覚えてるんですよ。はい、じゃあ次いきます。Okay, the next, confidentiality obligation, maintaining confidentiality. Like this. Okay, so caregiver should know the information on the user, personal information like age, clinical history, and family structure, the address. That kind of personal information caregiver should know to provide appropriate care service. But caregiver must not disclose any personal information on the user to third party. Okay, that is a professional ethics. Okay, even though after you resign the facility, confidentiality obligation will still be effective. Okay, still effective. And then, so please be careful about social network system, SNS. If you take a picture with user, don't upload on the internet, okay? If you have consent from the user, that is okay. But without any consent from the user, don't post the picture with user, okay? This kind of the confidentiality obligation in Japan is more strict than that in the Philippines. Please be careful. Then third one is prohibition of physical restraint. Physical restraint. This is an example of the treatment that amount to physical restraint. Like this. So restricts the movement by tying the body with string or put the restraint belt like this for user not to stand up, and then lock on the door inside to confine the user. That is also physical restraint. And then this, give a lot of the psychotropic medicine. That is also part of physical restraint. Okay. You see the picture? So I periodically visit the nursing home in the Philippines. Okay. This is a nursing home in the Las Piñas. I think the Las Piñas. And then, so their sister, younger sister, or elder sister and younger sister. elder sister is the one who stand up. Okay? Younger sister is on the wheelchair. Okay? I was surprised because elder sister put the restraint belt on younger sister. You see this. But of course, they don't consider as against the professional ethics, because the elder sister, I think that she support the younger sister, so that's why she put the restraint belt on younger sister. Restraint belt. じゃあ井上さん、how do you say the restraint belt in Japanese?
なんだろう。なんていうの日本語で。
restraint belt。
落ちないベルト。
落ちないベルト。まあそういう。
全然出てこない。
落ちないベルト。まあ確かに落ちないベルトですね。はい。
高速なんとか？
そうですね。そうですね。加納さん、これなんていうかわかりますか？
高速隊。
そうですね。高速隊です。
はい、聞いてます。
はい、高速隊です。そう、restraint belt in Japanese。高速隊。高速隊。Okay? So, when I work as a caregiver, I saw this kind of the 高速隊 in the nursing home. Because I know that everybody doesn't want to do the physical restraint, but for the safety reason, sometimes we have to do. But I don't know now in the nursing field there is a 高速隊 or not. 木村さん、今もこういうのってあるんですか？高速隊は。
Yes, we have in Japan, in the hospital and also in the facilities.
Still there is a restraint belt?
Still we do, because if she cannot stand up safely, we have to restrict not to stand up.
I see. How the caregivers feel because they against professional ethics when they put the restraint belt? How they feel?
Of course, every care workers do not want to do like this.
Yes.
But because of lack of human workers.
Lack of workers.
We have to do it. We forced to do.
I see. You know, unlike Philippines, Japan has lack of the caregivers. So if there are many caregivers in the nursing home, so we don't need to put this kind of the restraint belt because we keep eyes on each of the user, but because of the lack of the personnel, the people, we have to do. So maybe the Japanese feel the guilty because against the the professional ethics, but cannot do. Okay, thank you very much, Kimura-san.
But this case depend on the hospital or depend on the facility.
I see.
Some hospital or facility do like this, and some of hospital facilities do not do like this.
I see. Okay, if the staff from the city hall do the inspection, I think that they periodically visit the nursing home for the inspection, right? So if they find out this kind of the physical restraint, so what's going to happen? So facility have to pay the penalty, or
難しいですね。
難しいですね。
行政職員が見た場合に、
そうです。
ペナルティがあるかどうかってことですよね。
ペナルティがあるかどうか。はい。
No penalty.
No penalty. Even though the
but we have to report to the government.
Report the government. I see.
So think about we can solve this problem,
I
or
see. Yeah, I
we
see.
cannot.
So, okay, so even though the Japan set, this is one of the professional ethics, but it is a little bit difficult to follow this kind of the professional ethics. Okay, はい、ありがとうございます。Okay, actually, there are exceptions for body restraint, physical restraint. So, physical restraint are prohibited in principle, but if the condition below are, I cannot help, it is possible. Like this, impending, no other means, and temporary. So we have no choice, but have to do the physical restraint. Like for example, if the user suffering from the mental illness and then he or she try to commit suicide, we have to stop him or her, right? In that case, that kind of the case, so we have to do the physical restraint, the body restraint, but only impending, no other means, temporary, okay? Because we should respect the human right. Okay. Number 4 is prevention of abuse. There are 5 types of abuse: physical abuse, mental abuse, sexual abuse, financial abuse, and neglect. Okay. So in the Japanese nursing home, usually female users are suffering from physical abuse rather than the male user. Okay. Anybody who can explain what is the neglect? What is the neglect? Mimi-san, what is neglect?
I think it's like when a user needs your help to do something, but you don't provide the help that is needed. You don't attend to them, so that's kind of neglect for me.
That's good. Yes, you're right. So neglect means abandon the responsibility to take care of the people who need to be cared. Okay, like don't give the food, or that we just leave the user, leave the people alone. That kind of things that we say the neglect. Neglect is one of abuse. Okay. Okay, the next topic is this: multidisciplinary cooperation. Multidisciplinary cooperation. Okay, there are 4 topics. First, team approach. In the nursing field, okay, not only caregivers, but also other professional staff are involved to provide care services. Okay, like this. So the field of everyday life, caregiver or social worker or care manager support the users. And then field of medical care, nurse or doctor support, assist. In the field of the rehabilitation, physical therapist or occupational therapist and the speech therapist support. And the last one is a field of nutrition or meal, dietitian or cook support the user. This is a kind of the user-oriented service. We put the user at the center, and then all different professions cooperate and then support user from their profession. Like this: doctor, nurse, physical therapist, occupational therapist. How do you call physical therapist in Japanese? How do you call physical therapist?
理学療法士。
Very good, 理学療法士。 How about occupational therapist?
産業療法士。
Very good. 作業療法士ですね。あれ加納さん Are you occupational therapist?
Yes, I was an occupational therapist. Now,
you work now?
now a school teacher. But
School teacher.
Before, I was the occupational therapist.
I see. So did you work in the nursing home as an occupational therapist?
I worked in the Red Cross and Red Cross.
Red Cross.
Red Cross Hospital.
I see.
Medical center.
Medical center.
Yes.
I see. Good. So later on we asked him about what does he do as an occupational therapist. Okay. Later on we ask. Okay. Then the speech therapist and the social worker and the dietitian. Okay.
宇さん、
はい。
一つ聞いてもいいですか？
はいどうぞ。
日本では、
はい。
先ほどの作業療法士、理学療法士を、
はい。
PT とか OT って略すことが多いんですけど、
はいはいはいはい。
フィリピンでそのように PT とか OT って言った場合に通じますか？
なるほど。イサイさん
はい、先生。
What do you say?
はい。
So
ごめんなさい、先生。
Okay.
In Japan, we call physical therapist, occupational therapist, and make it short, PT or OT.
はい、先生。
And if we say PT, OT, can you understand?
はい。
はい。Here in the Philippines, we also use PT.
Oh,
PT,
I see.
Then,
I see. Okay, it's a commonly used PT, OT, ST. Okay, good. Hi, thank you very much.
Thank you.
Then, of course, the caregiver cannot conduct any medical procedure like injection or management of medicine and tube feeding from suction. These are medical procedure. Even though if you are a licensed nurse in the Philippines, when you work in Japan, you work as a caregiver, you cannot do this kind of the medical procedure. Then these are the non-medical procedure caregiver can do, like measurement of body temperature. You use the thermometer, okay? Then blood pressure, check the blood pressure, eye drop, and the preparation of catheter that caregiver can do, okay? But actually, due to the lack of the nurse, some, the Japanese government lift the regulation on the medical procedure. Some part caregiver can do after medical training, tube feeding and from suction. After medical training, caregiver can do tube feeding and from suction. Okay, so Japanese participant, anybody who took this kind of the medical training? 木村さん、木村さんやられてますか？井上さんは did you do this kind of the medical training? じゃあ you cannot conduct the tube feeding and from suction. No. So for me, I did before in the United States. So I didn't take any medical training, but I had no choice. I have to do this kind of the medical procedure. But in Japan, I couldn't. But I think for the foreign caregiver like you, after this kind of medical training, you can do. I know that Isai-san, you did this kind of the medical procedure, right? In the Philippines, in the Philippines.
はい、先生。
from suction. So,
はい。
but you need to take the medical training in Japan again. Okay, caregiver can do this kind of the medical procedure. はい。はい、どうぞ。
In Japanese is okay?
え
In Japanese is okay?
in Japanese?
日本語でいいですか？
どうぞどうぞどうぞ。はい。
私、経管栄養、tube feeding.
はい。
I don't have the license of medical training, medical, なんだっけ、medical, 言えない。
メディカルトレーニング。
持ってないんですけど、うちの母がもう、カーケアに入ってて、最後の、うちの、自宅に帰るっていう10日間だけ、経管栄養ずっとやってたんですけど、病院でちょっと教えてもらって、私やってました、10日間。
家族はできるんです。
家族はできるんですね。I see. Okay. Thank you very much for your comment. So, Miss Tatsuki said she used to take care of her mother. お母さんですよね。her mother. Then her mother using the tube feeding. Then she's the one who do the tube feeding. And then Mr. Kimura said family member can do. But of course, she took some training, right? From 看護師さんから教わったんですか？
看護師さん、そうですね。看護師さんから。
I see. So she learned from the nurse. I think the hospital nurse. Then she did this tube feeding, and then この痰の吸引もやってたんですか？ From suction.
吸引は傷つけるからっていうので、訪問看護の看護師さんがいらっしゃった時にやってもらいました。
なるほど。はい。Okay.
I did hand queuing for my grandmother.
You did?
Yeah.
So you also learned from the nurse, from suction.
Yeah, but just explain.
Just explain. I see.
Long time ago.
Long time ago. So
it was not so strict like this.
So from suction is a very hard to do. So if the nurse has less experience, so maybe the user is so the かわいそうな。Okay, thank you very much.
Thank you.
Okay, let's discuss these two topics. Okay, today's topic is this. How do you prevent physical restraint? I mean so when you encounter the caregiver needs the physical restraint, how do you prevent the physical restraint? How do you prevent? Okay, then second one is how do you improve a team approach? As I told you, the caregiving is not only caregiver, but also as a profession, cooperate together to provide the care service. So how do you improve the team approach? So you can choose one of the question, or you can discuss both of the question. Okay?
Team approach?
チームアプローチですね。それ介護士だけではなくて、いろいろな職種の人が利用者さんのケアを行いますので、それを、どうやったらそのチームでのケアを向上させていくか、このテーマで、話し合っていきたいと思います。はい。じゃあ、ちょっとお部屋を作りますので、はい、わかりました。はい。ありがとうございます。お部屋を作りますので、少々お待ちください。じゃ